and as you live your life, you decline.
Right.
We all decline. We want to get you back to as close to 100% as we can. So that's our interest and our goal. We want to regenerate what already was present. We cannot bring back what is already dead. That is what the Most High.
All right, I like that angle. Now, Dr. Williams, tell me about this regenerative aspect of medicine. What exactly does it mean? And what is it part of the body? Are you regenerating cells, organs, or you're regenerating the soul?
Very important, yes. So we're regenerating organs. You know, when you went to the doctor, he usually went and he gives you medicine, gives you more medicine. And as you age, eventually medicine doesn't work. The next usually is surgery, some transplant. So the emerging field of medicine that is taking place, it's all have to do with stem cell and trying to regrow the organ. Emerged around 20 years ago. Essentially, it started first with surgeons that were having difficulty with wound healing after surgeries. So they started to figure out how can I get the tissues to heal properly. Then after that, the technology from that was started to use on different parts of the body to regenerate tissue. So before you use medicines, and then if medicine doesn't work, you go to surgery. Now the approach now is let's take the organ, and as the organ age, it goes from 100%, and you know, as you start to go to end of life, you start to operate at 20%. So let's take this organ.
Sounds scary, Dr. Williams. End of life. Oh, come on. It sounds scary already.
But unfortunately, it's our feet. It's going
to die.
Now,
Dr. Moore. You know, Dr. Williams said something about as you age, said something about it used to be maybe 100% before, now you get 20%. Now, when you're talking about this regenerative therapy, for the person listening now, is it just for those that are old already? For those, what age are you looking at? For those who you think they need regenerative therapy the most? So
the focus again, let's so we can focus down. We're focusing on sexual function, pathological function, skin, and joints. Okay, that's what we're trying to do. Apply the regenerative therapies to, and just logically thinking about it, the younger you are, the healthier you are, the more viable your tissues are.
Right.
The more we have to work with. The older you are, the more you've lost. Like I said, we're not trying to recreate stuff. Not right now. That might be in the future. We're trying to take what you've lost and give you back some more of the function you've lost before. So, in answering your question, the older you are, the younger you are, absolutely in everything in life, the more results you get. But as you get older, everybody has their own specific, your body type and all. So the results are not necessarily. I've seen an 86-year-old 2 days ago, and I told her that we need to get her blood sample and take it to the lab and go study it. Her skin was like a 25-year-old woman without any surgery. I'm telling you.
Let me guess, she's mixing vegetables, I guess.
I don't know. I asked her, you're 86? She said, yeah, you cannot be 86. But that person, that 86-year-old, is not the same thing as a 65-year-old who's dealing with, diabetes, terminal, lung dysfunction, and all that. So it just depends on who you are. But typically, the more you have, he who has much is given.
Expected.
Yeah. So that's how it works. The more you have, the more it can be restored.
Dr. Williams, now let's pin it down. This week, I think it was last week Sunday, and we still did it on my show this week. We're talking about elder care awareness and all of those things. And I think the UN celebrated, elders awareness and abuse campaign and all of those things. But is it that truly, just like it is, maintenance culture is a big deal for us in Nigeria? We complain a lot about maintenance culture. We don't maintain our infrastructure well. Unfortunately, some of us don't maintain our body well as well. So maybe that's why as you grow older, you can't use your joints, your legs, your body the way you normally will, maybe 10 years ago, 5 years ago, or even 2 years ago. Now, what are you bringing differently? What therapy are you bringing differently? And how will they impact the lives of Nigerians right now?
For instance, so part of regenerative therapy that we focused on right now is arthritis of the knees. And so the treatment you usually give is that you go to a doctor, we give you paracetamol, we give you ibuprofen, and after a while these things may cause some side effects. And if they don't work out, eventually need surgery. So what if we now grow some more of the tissue, the cartilage in the knee? This will help you to avoid medicine. And so this is the beauty with it, and avoid surgery, which in itself has its own downtimes in terms of healing. So we focus on arthritis of the knee, erectile dysfunction. If a person is 60 years old, we could we could help him improve to his performance at 40. And then we also help microneedling, and PRP is very common with aesthetic medicine for beauty in terms of getting help with the rejuvenation of the face. So these are the focus area at this time.
All right, so let me come to Dr. Moore again before we go. Now, so what's the specific, well, what specifics are we talking about now? What would help? You know, what you said now sounds like magic. You're focusing on, arthritis of the knee, you're focusing on, helping dysfunction for erectile dysfunction. Also, therapy that could actually help you renovate your skin and make you look even a lot younger. So what specific are we talking about here?
So speaking to the general public now, we're talking about what we call the platelet-rich therapy, or PRP. Okay, so essentially, the way we are designed as human beings, our bodies have repair agents, things that can fix things that are damaged.
On automatic level, right?
Yeah. So what we do is essentially, okay, what is that stuff in my body that does all the repair work? Can I collect a huge concentration of it and apply it to a certain area with a specific damage and see how the person responds? That's it. It's not, that's one of the methods. We have other things that we already might talk about. But essentially, once it's called the portion of your body that does that is it contains what they call the platelets, right? So we concentrate that and we take that and apply it to the specific part of the body that's having issues, the joints, areas of sexual dysfunction, and the skin. We're trying to rejuvenate here. And what happens is that it begins to restore because remember, this is healing. And the things that are damaged are not as good as they used to be. Taking that concentrating healing portion of your body and apply to the damaged areas results in restoring some of the function.
I mean, I'm intrigued, right? Dr. Williams, it looks like I'm putting the trickier ones to you right now. If by design my body is expected to auto-heal or to correct itself, why then do I need some extra therapy to aid that process?
So even though you do have these mechanisms, what we're doing is we're now concentrating the mechanisms to focus it on the specific area to improve the outcome. Because if your body was to automatically do it by itself, then you wouldn't have the breakdown to begin with.
I see what you did there. I like what you did there. So that the fact that there's a breakdown, that means something isn't right somewhere.
Yes.
And you're preaching something differently. Now, for those listening, they want to be a part of this. They want to understand more. They want to get more insight. How can they reach out to get more insight?
We have a website. It's wprimemedical.com.
Okay, you want to spell that out?
It's WPRIME.
Okay, Prime. All right.
MEDICAL.
Okay, Prime Medical.
Prime Medical. Yes. So apologies. It's.
Or maybe if there's any way we can just reach out to you and just to gain more insights. You want to talk about that real quick as well. All right. No, it's all good. It's all good. So, for those maybe they're just listening, you just want to gain more insights. We're talking about regenerative medicine, knee pain, joint pain, and all of these things we've talked about. There are ways you can actually reach out, and that's one website you already heard earlier, WashingtonPrimeMedical.com. that's how you can actually be a part of this one. I don't know, do you have social media presence, maybe on Instagram, on Twitter, or any social media presence for at least the younger generations who are caring for the older ones who may want to also maybe recommend to those around them?
We're going to work on this now because to improve. I know that, when you were asking earlier about which age comes to us, it's usually when the body starts to break down.
Right.
So we are seeing people more along the line of their later 40s to their 50s.
All right.
But we do know that
All right.
we need to get the younger generation.
We need to go. Maybe you want to drop maybe like a number.
Phone number is 0916-395-5392. Once again, 0916-395-5392.
All right. So thank you very much, Dr. Rory Williams, for coming around, and of course, Dr. Simon. Final words from you.
Well, yeah, that's don't wait until everything falls apart. It's good to get the care that you need, and any way we can be of help will be appreciate that. I think the location is at 106 Ogunisi Road, Isheri, Ikeja, 101233, Lagos, Nigeria.
Opposite road safety.
All right, so that puts it absolutely. Thank you very much, Dr. Rory Williams. Thank you, Dr. Simon Moore. The thing now is, we had a short while to talk about this. I'm sure we can have have it repeatedly so that people can actually understand what they need. Sometimes people don't understand what they need until you show it to them, like, this is what you need and this is how it will work for you. So I'm hoping that with time we get to have this conversation again, over and over again. I hope that's fine by you.
Sure, definitely.
Thank you very much.
All right, thank you very much. Of course, it's a breakfast break, and that's our time right here. I still have messages. I'll take a breather, and when I come back, I will squeeze in all of these messages. Victor Idi and Bella Schmoder saying, it's clear. Stay here.
Fine boy Bella, smoother ranking, big straight from Wally. We the Wally. Some of my men don't go, I'm just decomposed. Some of my men don't joke, some they don't get cool. Some of my men don't blow, and some don't get close. Some of my men they fancy, they are supposed to go. But anytime to show me, do I don't bomb me, I take them load on me, my life is not fair. Anytime to show me, do I don't bomb me, I take them load on me, my life is not fair. Every time I sit back and I reminisce, look into my past and they thank God for this. Nobody fit there, them know my feelings, yeah. Every time I sit back and I reminisce, cause it's obvious. The problem now money,